Good evening, everybody. How's everybody doing this evening? Seems like it's been a while since we all been on, hasn't it? We're right at 6:30, so I think we'll give just a tad bit longer for a few people to hop on, but we'll get going here shortly. All right, we'll go ahead and get started. Again, welcome everybody. Thanks for hopping on this evening. Like I said, I think it's been a while since we've met, so it's good to be on again. And know there's a lot of work that's been going on the past several months between all of us. I know for CCL definitely, and I mean for everybody on the call. So good to be back and get the group going again. So I am Jarvis Dolman. I'm the Director of Operations for Chalker Licensing with KDHE. Previously, Melissa Schoenberger had been overseeing these meetings along with our partners from KU. As many of you know, Melissa transitioned to a different position with the Children's Cabinet. So due to that, I've assumed the role of overseeing these meetings in the SIT team. So I'm happy to be on with everyone and continue to move this very important group forward. So I'll pass on to Megan to get us going on our agenda.
All right, good evening, everyone. I think I know everybody, but just in case, or it's been a few months since we've been on screen, I'm Megan Cluth. I'm with the University of Kansas Center for Public Partnerships and Research, and we provide kind of backbone support for this group. So as Jarvis said, I know it's been a little bit since we've been together, but we appreciate your time and particularly on an evening. So we've got a pretty full agenda. We're going to have, I know we have at least two new members joining us, so want them to introduce themselves. Um, Given that it's been a few months since we've met, quite a bit has happened in our early childhood system, and so we want to share some of those updates and then hear if you all have any updates to share. And then we'll spend the bulk of our meeting kind of talking about the focus last year was really on the regional roundtables that were hosted throughout the state. So we want to share some themes that we've pulled out from those conversations and then brainstorm with you all, like, what do we want to do with that information next? And how do we, as a group, want to move forward and on kind of defining our focus areas for the next 9, 10 months. So with that, I know we have at least Melissa, who is not, she's, as Jarvis said, in a new role, not technically a new member, but I would like her to introduce herself, and then Jen Burgart. And then I am so sorry if I'm forgetting anybody else who's here for the first time, but this would be a great time to introduce yourself. So, Melissa, do you want to go first?
Yeah, good evening. I almost said good morning, right? We're not going back. We can go forward, but we're not going back. I am Melissa Schoenberger, and I am the early childhood systems specialist with the Children's Cabinet. It's kind of fun to just be a part of this group and sit back and be off camera and finish my supper and let Jarvis take the reins. So thanks for having me tonight.
Jen?
Hello, everyone. I'm Jennifer Burgart. I am facilitating the role of Child Care Zones Coordinator right now for Kansas Department of Health and Environment under the Child Care Licensing umbrella. So glad to be here.
And then Jennifer Manuel, do you want to share? I know your role has changed a little bit. Do you want to share that since that's happened since we last met?
Oh, well,
I put you on the spot. I'm sorry.
Yeah, no, that's okay. Yes, I have taken over Melissa's previous position. So I am now the Director of Systems and Field Services. So Jarvis and I are co-directors.
Wonderful. Thank you. And then is there anybody else? Again, I'm so sorry if I've forgotten. I don't know about you, but some of the past few months have felt more like closer to years. So it's hard to remember who introduced themselves when. Okay, perfect. Perfect. Well, lots of familiar faces, and it's really nice to see everybody. Okay, Derek, I'm going to pass it to you to talk a little bit about House Bill 2045.
Lucky me. All right. Hey, everybody. I'm Derek Flerlock. I'm the Bureau Director for Family Health. At KDHE, I'm also the Bureau Director for the Disease Control and Prevention as well. So a lot of different programs under that umbrella, but childcare licensing is one of them. So that's the reason I am here. I will say I was flashing back to a few years ago now. My first SIT meeting was actually a Tuesday evening meeting, and I'd be lying if I didn't say way back then that I thought that was just like the norm. I'm like, oh, okay, I guess I'm doing, evening meetings from here on out. That's perfectly fine. But happy to be here with everybody, lots of familiar faces, and some that I don't think I've had a lot of interaction with. So it's good to see everyone on the screen. I will also preface this by saying I'm a dad of 4 now. Had to make sure I got that right. My wife Kaylee is a labor and delivery nurse. She is working tonight. So if you see children running in behind me or me, saying stop that or please don't or just give me 5 minutes, please, guys, that's just the dad side of me coming out. So thought I better get that all out of the way. So House Bill 2045, as you all are probably well aware, created the Office of Early Childhood. So it passed this most recent legislative session, 2025. It establishes the Office of Early Childhood, which will essentially take several of our early childhood programs in the state that are currently residing in different state agencies into one office. So really consolidating those programs into one single office. Um, you know, right now, still currently, we have childcare licensing, obviously at KDHE, but the lead portion of that of childcare and then the subsidy piece, obviously quality, all of that good work is with Department for Children and Families, DCF. The Children's Cabinet obviously plays a huge role in childcare and early childhood across the state. And then we have the Department of Education, which is at the table for some of those discussions as well. They're also in the home visiting game, I will say, which KDHE is also in. Home visiting is one of the things that's being consolidated down into this new office. And really, the point of all of this is to kind of streamline the way things are working, bring that all into one office, all under one roof. Sometimes going across agency lines is a little difficult. We all have our ways of doing things. And so having that under one roof, I think, is not only going to be a big benefit to just the way that collaboration can take place and the work, like the current work that you might know of, can occur, but also future work. It just makes things a little bit streamlined is probably the coined phrase here. It makes things a little bit more streamlined and easier, dare I say, easier for them to happen. So there have been obviously there's been some regulatory changes from that bill as well as far as childcare goes, as far as childcare licensing goes, and so I know some of the notable things that have come up. Obviously, as I call it, the licensing threshold that has been implemented. So now we're looking at that for children. My gosh, I have to think back to legislative session. And so we've got a little bit of a change there. That also has instructed us to adopt that into regulatory language. So you'll see the very specific sort of threshold in regulatory language as well. It does lower the amount of annual in-service hours for home providers only, if I'm not mistaken, and then does a bevy of other things. For the providers on the call and even for non-providers, you may have seen some communications that we recently sent out. There was a technical issue in the bill that had to do with the definition of school-age children, and so we've tried to issue a sort of a quick fix for that, at least over the next year, and hopefully there'll be some legislative cleanup to address that. In the interim, if you do serve school-age children in centers and preschools, am I forgetting one there, Jarvis, Jennifer? Centers and preschools. Then just check your email, I would say. I'm not going to recap that entire email for you guys.
Centers and SAPs, yeah.
Yep, school age programs. I'm missing the most obvious one. It just hit me too. I was speaking school age programs. So, so we've had to do some sort of creative things like that just to kind of curb some of the things that comes from the technical issues from the bill. So certainly the intent of the bill was to not decrease licensed capacity at all. So that was something that we wanted to be quick to address. As of this moment, we have some of that drafted language. Again, everything that we need to adopt in regulation is outlined in the bill. So I just encourage you to read through the bill. You can actually probably just Google enrolled copy House Bill 2045 in Kansas. Or if our CPPR friends are really quick, there might be a way to get it into the chat. You're welcome to read through it, but the language, or I'm sorry, the bill really dictates the language that we need to update in regulation. And so at this point, we've taken that language, we've put it into drafted regulation updates, and then those are with the Attorney General's office for review. We do still have to go through all of the promulgation, a 60-day public comment and public hearing. And so we got to go through all the steps of that as well. So there will be some time between now, of course, and when the formal regulations are adopted. But to be quite honest, we've adopted these already. So the new licensing threshold's been adopted since before July 1 when the bill went into effect, and some of the other changes that we're trying to institute from the bill as well. I think as far as timelines go, so you all may be aware that there is a transition and implementation director from the governor's office. That's Zach Vincent. Zach's been doing and going to do a great job, and his job is to really kind of coordinate everything. There's an executive director position. And the best way to think about that is in terms of like a secretary of a cabinet agency. The executive director of this office is appointed by the governor. There is an application process for that, and it is live. And so, again, if you all want to go to the state jobs portal, I think that's what it's called, then you'll actually be able to see the posting itself. Has some requirements that they're looking for, of course, with that position, but it is public. I believe based on the bill language, that person cannot start until January 1. So lots of dates in the bill. There is a window for the office to sort of become operational and programs to transition over. And technically that is January 1 through July 1 or through June 30th. Now we are unsure at this point, which programs are going to transition when and what that looks like exactly. But I'm sure more details will come out as they are available and a formal plan is in place. So a lot of those things are being worked on as we speak. The agencies have been asked for even before this, were asked for program specific information, how we do things, some of our agreements and how the system kind of functions. And so I know they're really trying to ensure that this transition and this implementation is as smooth as possible. Again, the intent is not to decrease licensed capacity. In fact, it's to increase it. And I think it's, the intent's obviously to be helpful. So I think with that, I'm going to look to Jennifer Jarvis. If I'm missing anything, or Megan, if I've left anything out, there's quite a bit within the bill. We could honestly spend, the entire hour and a half reading through it, but I won't bore you. So.
No, I don't think I got anything else to add to that. I think you summarized it pretty good.
Yep.
All right. I'm trying to think of any other big regulatory changes that have come from that. That I'm forgetting about. Of course, folks can put stuff in the chat if there's questions about any. We'll try to answer questions on the bill as far as how they're affecting licensing, or if there's other questions that you all have related to the Office of Early Childhood. Again, we might not be able to answer them, but we can certainly document them and try to get the answers for you. So.
Derek, I had a question.
Yeah. Oh, hey, no.
Hi. When you talked about the licensing threshold, are you talking about one provider now being able to care for 4 infants?
Up to 4 children, 2 of which can be infants. 4.
Well, I wasn't talking about the.
Oh,
the
okay.
what I
Talking
was
about the
talking
language
about, I thought also in the bill was that it now made it that one provider could have up to 4 infants under age 1.
Yeah, so the bill itself doesn't create that ratio. What it does, and I can't speak to intent behind it, but what the language in the bill does around that and now is kind of creates some specific training requirements for providers that choose to serve that many infants. So the way I kind of view it is, if the state were to move to a 1-to-4 ratio, then there's some language built in about, extra training and education. I think it's just training requirements actually around what those providers have to do to basically be, Jennifer, just slap my hand here, for lack of a better word, qualified to care for them, or approved. You know what I'm trying to say, hopefully. So,
Right. So right now, in essence, we're not really doing anything with that because we don't allow for by
Okay.
yourself.
correct.
Good, thank you.
Any other questions on this bill? Okay, well, obviously there's a lot of change going on with the Office of Early Childhood coming, so we will certainly make sure you know where to find up-to-date information as that becomes available. And of course, reach out to any of us if you have questions as things unfold.
Megan, I was actually going to mention, the one thing, I really apologize.
Oh,
The one thing that just came to mind that we have been getting questions on is around immunization requirements, because there is language in the bill around immunization requirements and exemptions. In reality, that doesn't change the practice of what we've been doing is licensing, and Jennifer's welcome to expand on this as well. But essentially, providers can still choose, it's still their decision, business decision, whatever it might be, to allow for kiddos that have not been immunized or received vaccinations, age appropriate vaccinations. So really all this does is changes some language in there about, and I'm going to generalize here, but it changes some language where they can sort of just exempt themselves based off of a closely held belief. That terminology is probably not 100% correct, but close enough. Previously, it talked about sort of belonging to denomination or something like that. In reality, we had never, we kind of joked a little bit. We had never gone down the street and checked with, the local pastor or priest or whomever to say, hey, is so and so really a part of the church, or really a part of this faith, really a part of this denomination? So our job is to ensure that the children have exemptions on file if they do have one, and if they don't, they have to have their immunization record on file. And Jennifer, I know we've talked about that at length, and so if that's incorrect at all, please correct me on that.
Nope, you're good.
All right. That's it, Megan. I think that was
okay, no
the other
worries.
one that we've received a lot of questions on too. So thought I better throw that in there as well.
Yeah, absolutely. No, we want to make sure people are working from the same information. So
And of
thank
course,
you.
being KDHE, I do have to, encourage the effectiveness of vaccines. So, holler if you got questions on that too. Thank you.
Thank you. Okay, so several of you may be familiar with this, but just wanted to make sure you knew what's going on with the childcare zones. So Jennifer Burgart shared that she's the childcare zones coordinator. So actually, Jennifer, I feel kind of silly giving this update, but since we work so closely on it, hopefully you'll be okay with that. So KDHE has been quite busy over the past few months leading a new grant-funded initiative that really took a model that they had from some of their maternal child health work, which is called Aid to Local. So essentially state funding that really empowers local communities to say what they need. And in this case, it's been specific to childcare. And through this grant, 2 or more counties need to come together to say, here's the data we have that's showing these are like the most critical needs related to childcare in our community, and here's how we would like to collaborate to address them and really build what we call like a regional zone for childcare. So this spring, we started with 4 grantees who got their projects off the ground this summer. And then we have 3 new grantees that will be announced soon that will start this fall. And as we can share more about their projects, we will bring that back to you all, both so you can kind of see geographically where they're located. But also, I think there's just a lot of kind of interesting themes that would be relevant to this group to see what communities are saying are the biggest needs and how they're trying to address them. So it's true that no two zones are the same, but also there are a lot of common themes across them. So not a lot of surprises that workforce, wages, business engagement, just finding additional funding sources, professional development, like family choice, lots of those common things. So Jennifer and I will work together to bring you some updates on what's going on as people get further into their work. But certainly if you are wondering if there's one in your area or if you can get involved, just reach out. And then Jarvis, do you want to share a little more about the new licensing system coming soon?
Yeah, so hopefully everybody's aware that we have a new system coming. We're getting rid of Clara. She's been around for a while. We thank her for all her service and you know all she's done for all of us over the years. But yeah, it's been time to move to a new system. I was looking back, and yeah, we started this process. At least we kicked off our work with our vendor back on January 29th of 2024. We see what the date is now. And even before that, we went through tons of demos. I mean, back in the spring of 2023. So it's been a really long road for us that have been working on this project. So we're excited to see it come to fruition. Like I said, we've been working since January 29th of last year with the vendor. We're moving close into testing the new system. We've done a lot of design in the system. Hats off to all of our staff that have been in those meetings because it's been a ton. We've been trying to juggle each other's schedule. Sometimes 30, almost 40-hour work weeks on just working with the vendor. So it's been a lot trying to juggle, that bringing on a new system and designing it and also getting the normal work done. But really proud of our team of what we've been able to do, the improvements we've been able to make in the program, and also, working on designing a new system. So, like I said, testing is set for the 29th, so just under 2 weeks. And so that should last about 60 days, hopefully. We have a go live date. Hopefully it stays. We're hoping and that we're not going to have any changes that come, but towards the beginning of February, I'm sorry. So that's when we're looking for go live on that. Yeah, just we've had a couple slower weeks as far as with the system and the work, but so it's been nice for our staff to kind of do some actual the past couple of weeks, but things are getting ready to ramp back up here when we start testing. So we'll be heavy in that. So yeah, just excited about the new system coming online. We've got a lot of updates that I don't want to say hope because we know we're not going to be better than what we have now. We're excited for our providers and our partners to be a part of the system. We are going to do testing. Once it rolls out, we're going to make sure we're going to have testing with providers and with our partners, ton of testing. Yeah, we're looking at different ideas to do that, whether we're having staff work some extra hours to do some evening trainings, and we're going to make sure too, we put out information and put out, questionnaires of when the best time is to do that. So we got a great team working on it. Our project manager is amazing at what she does and keeps us on track and, keeps us in line of the things we do need to do. She's worked on a new system before, so she's got good ideas and things on what needs to happen when we kind of roll these things out. So yeah, just want to give you all an update on that. We're getting close to the finish line and just trying to ramp up excitement for that for our staff, and hopefully we get some communications out to providers and partners soon to kind of timelines and stuff and what we're looking at doing. So yes, the system does have a name. We're calling it licensing system, licensing network in Kansas. I'm sorry. So it's going to be short. We're going to call it LNK. So try to keep it, with a short acronym. I know Claris is pretty long, so we tried to keep it, shorter and easy to remember. So licensing network in Kansas at this point. So.
Thanks, Jarvis. That's exciting to hear, and good luck as you near the end.
Thank you. Thank you.
I was going to hop in as well. We actually just had a legislative oversight meeting on that today. Those are quarterly, but just wanted to let everybody know the project itself does have legislative oversight, and it's got the state, the Kansas IT office oversight. So we have to do a lot of special reporting and a lot of special meetings with some auditors. So that's all public documents. If anyone's interested, you can kind of go in and see the story of the project. I just like to encourage transparency. But by all accounts, we're doing well, and I can't tell you how, just seeing Jarvis's eyes light up when he talks about something other than Claris. So excited to see the modernization that it brings. So I'm excited.
Well, we will definitely stay tuned on that. Okay. Is there, I mean, again, it's been a few months since we met, so feel free to share any, like, if there's bright spots or things that have changed in your world over the past several months. We really want this to be a place that we celebrate, but also if there's something you want to help promote or that you need help from this group, this is a time we will always hold each month for you all to share what's going on in your world.
I would be
Hey,
happy to
Megan.
share.
Oh,
I'll say Dana and then Melissa, because Dana, I think, technically was first.
Beat you, Melissa. I'm happy to share that the Innovation Center received a grant from the Patterson Family Foundation to pilot a home-based childcare recruitment initiative. So there's some grant dollars tied with that to hopefully, for our part of the world, a lot of times a home-based childcare makes the most sense in very small rural communities. So we're very excited that will kick off in January 2026.
Nice, congratulations. That is very exciting and certainly a need.
Hey, Dana, I was going to tell you that the secretary actually asked me about that the other day. She goes, "You know anything about this funding stream?" I said, "A matter of fact, I do."
I would love to talk to anybody about it who would like to listen.
There you go. I'll pitch it to her. Thank you.
Thanks.
All right, Melissa, you're up.
yes. I just wanted to share that the state ICC obviously has a local ICC committee, and that the ICC is the state agency or the state organization that looks at Part C and Part B services for our young children in Kansas and our older children. But the local ICC is going to have a free virtual event on October 24th from 8:30 to 12:30. And it's really a great topic, screen time and young minds, what's the real impact and what can we do instead? And it will be a course that is KDHE approved for licensing, that licensing specialists will accept. It won't have a traditional KDHE, like a training number or under that umbrella. It's through our Tanzan partners, through KSDE. And there is a policy exception that licensing has that provides that oversight. So I'm going to drop in the registration. Please share far and wide. I know Jennifer already shared it with licensing specialists, and hopefully that went out to providers. But the more, the merrier that we can get. Again, free. I know it's during normal traditional hours, childcare hours, but hopefully maybe you can still listen and get your hours.
Thank you for sharing that. Definitely sounds like a timely topic. Any other updates?
One thing is I found exciting is New Mexico has been working on it, and they have done what I think they're calling universal free childcare, and was voted in. And it was just exciting to read about that. And then also Vermont is doing some really interesting work there. So I always thought it would come down through the federal level, but I'm beginning to think it's going to come through the state. So, but it's encouraging.
I appreciate you bringing that up. I think as much as it's exciting to talk about what's happening in Kansas, like sometimes somebody just needs to be the first sometimes. And I think, New Mexico is getting some very well-deserved credit. I will drop a link in just with a little kind of overview of what Anil is sharing, because I think that was earlier this month that they announced that. So yeah, first state in the country to promise free childcare for all families. So that is a huge win, I think, for all of us, and certainly something for us to be inspired by in Kansas.
I do have one more bright spot, and Derek, if you want to jump in, you're free to share with us too. Derek and I are on a cohort of 12 individuals representing all sectors of the early childhood ecosystem. And then we're called the Systems Change Framework Session. And it's really a technical assistance from the ECE Workforce Center. And we're really focusing in on looking at the workforce and really honing in on our career pathway. And so we're working with partners from DCF because it's part of the state plan, and then our partners from Casito, and really looking at how we operationalize the career pathway, which when you mentioned New Mexico, and now New Mexico had also received technical assistance from the ECE Workforce Center. And I would hope was a driver behind some of that state systems change. So we are really in our infancy. I think we've met twice, and really we're just discussing the rules of engagement. And so really excited, and I'm sure Derek will have information and just keeping the systems improvement team up to date as we move over this next year with the project. Derek, did you have anything you'd like to add?
I think just how lucky I am to probably be a part of a group with so many experts. So we've had a couple meetings, and it's been really interesting. And I know DCF, it just, I guess all the folks that we've got together kind of across the system. So I've learned a lot in just the few meetings that we've had. And I think the other kind of glaring thing to me, Melissa, early on is just the different perspectives that everybody brings, and there's a lot of good open conversation going on. So yeah, really excited about that.
Thank you.
I'll share quickly. In Reno County, with our Reno County Child Care Task Force, we actually launched our Kids Collective, which is a child care management company that launched on September 1st. It's been about 2+ years coming of kind of the work of, we've been looking at what the data is telling us, what our needs are in our community, and so we're excited that it's off the ground. We've had a lot of interest. I think we're excited to see where it goes, but we will continue to do shared trainings amongst our entire community. We're looking at more deepened partnerships and what that can mean for our community, but we're excited that it got off the ground at the beginning of September, and we're going to continue to learn and grow and adapt. But we're excited about what it could mean, and there's a lot of excitement at the other providers too in our community on what it can mean.
Yeah, thank you for sharing that, Abby. It is congratulations. Like I have been fortunate to be able to follow from a distance. The work you all have done in Reno for a few years now, and it's just super exciting to see what you've put in place. And for anybody who's not as familiar with Kids Collective, I highly recommend you check out their website, because I think it's a big deal for Kansas, and it's a big deal for Reno County. So congratulations. I know you and your team have put many hours of work into that, and I hope it feels really good to see it come to fruition. It's really exciting.
Yeah, thank you.
Anyone else? Okay. Well, again, we do this monthly, so it's always a good place to stop and celebrate. I know many of us feel like there's just so much work to keep doing, but I'm a firm believer in need to stop and say the things that we're making progress on, or that our neighboring states or other counties are making progress on. So thank you all for sharing, and we'll make sure to drop some of these links in our meeting notes as well. Okay. So the rest of the time, we're gonna talk about like the regional roundtables that happened last fall and through this summer. And then kind of also talk about just like how are you all feeling about the state of childcare and like what this group should be focusing on over the next several months. But before we get there, we wanted to just like kind of reset because I know this group has had a few different iterations and people have been in for various lengths of time. So we just wanted to kind of like remind you kind of where the sit has been as we start to think about where we're wanting to go as a group. So and we can drop a link for this in the chat or the notes. But for those of you who follow the All In for Kansas Kids monthly webinar, Derek and Jarvis presented an overview of just the childcare licensing work and the history of this group in I believe July. It was over the summer. And so we kind of pulled a little bit of the highlights from that, but certainly we can share the recording if anybody wants to hear more about that. So this group started like 15-ish, a little more than 15 years ago. And the recommendations at that time really, I think, had very similar focuses, but obviously different content at the time. Child safety, quality of care, regulatory consistency, all of that. I think the probably most notable thing from this group back at that time was that they helped inform the passage of Lexi's Law. And then, continued with that path for several years, took a break, and then because of the preschool development grant funding that came into Kansas in 2020, the group was kind of reconvened, and we've been active since then. We have actually put out, I think, 14 recommendations to date for this group, which is pretty significant. And so we didn't want to tell you all 14, but just wanted to kind of remind you, again, as we're thinking about like what comes next and potential recommendations or just work this group might want to focus on, kind of some of the things that we've done. And we can share in more detail like where all of the recommendations are. But some of the things that this group has helped achieve really over the past 5 years has been this group recommended the development of an awareness campaign around childcare that was implemented and has been like a live campaign twice throughout the state. It's called Childcare Matters. There was a development of a toolkit for new providers. I think this group has talked a lot about like how can we make it just a simpler process for anybody who's interested in becoming a licensed provider and like what are the steps that they may need to do. And even when people do their annual review of everything, just like quick reminders so that people aren't digging through, dozens of pages of information to remember what they might need for their survey. Publication of the staff qualifications chart. I know there were some questions about just what does this look like? How can providers easily access this information? So that was taken care of by this group. There's also a lot of conversation about like training access a few years ago, and specifically how do we make sure that people around the state can quickly access a group of people who offer required trainings like CPR and first aid. And then we also looked at this regulation on the screen to talk about like, we know sometimes people need short-term staff coverage, and so where can there be some flexibility? So that gives you kind of, again, that's not all the information, but we just kind of wanted to like ground the conversation and where we've been. And certainly there's room to revisit those recommendations if that feels like that's helpful. But then as we start thinking about like what comes next, how do we build on that? So bear with me, I'm going to give you a fair amount of information, and then really we want the bulk of this to be conversation with you all. This group is intended for you all to help inform childcare licensing and make some decisions on what you feel like the most pressing things for this group to be working on over the coming months are. So as a reminder, we hosted several regional roundtables starting last November. In the end, we actually had 7. We ended up hosting a smaller one in Johnson County following some requests in August. That has happened since we last met, but we really were able to cover really each region of the state. And the purpose of those conversations was just to bring providers, families who are using licensed care, communities who are involved in childcare coalitions and things like that together to say like what is working that we want to make sure is continuing to work in your region and potentially could be scaled in other places. What are the biggest needs that you're seeing? And then how can the state better support childcare locally? And we were really intentional about framing that last question as the entire state and the entire early childhood system, knowing that some of the responses might be beyond the scope of childcare licensing. And I think this group is kind of always held this, I say tension, but like tension in a positive way of, yes, the focus of this work is really childcare licensing, but we know there are a lot of like adjacent things that affect childcare licensing. And so certainly there were some things that came up in these conversations that maybe some of our partner agencies would be better suited to respond to. But I think KDHE felt the responsibility to help gather that information and pass it along to those other state partners. So we shared ahead of the meeting like a spreadsheet that goes into this in more detail with themes that we saw in each area. So I have a few on screen, and again, I'm not sure any of these are going to be terribly surprising. I think these are, I actually think it really affirms things that have been shared anecdotally in this group, but wanted to just bring it up again as we're thinking about like, okay, what do we do with this information? I think we got a lot of good information from around the state, and we really want to be responsive with it and make sure those who attend those conversations like see that they were heard. So again, I'll run through these quickly. Not surprising, workforce recruitment, retention. I think just that like not feeling valued. I think the daycare language came up. Wages, benefits, all of those things. Training came up quite a bit. And again, these are regional. So these, in some pockets, it was like a different response, but some areas said just being able to like access training quickly when they have the need, having like the right balance of virtual and in-person options. I think based on people's geography, like feeling like they might need to go fairly far to get a training. More opportunities outside of business hours, just more options, and being able to even like look at like what trainings are people doing in other states that might be available. And then I think this one was more specific to the Southwest, but making sure trainings and I think just resources in general are available in multiple languages. The kind of like business needs came up a lot with providers, which is also something this group has talked about quite a bit. I think where are there opportunities for other funding sources? How do we help make sure that people know what funding is available when it is to help with like quality improvements or wage supplements or stipends, retention stipends, stuff like that. And I think also just like general business practices, I think has been a common need we've heard throughout the state for providers. Challenges navigating state level supports and resources. I think this is not a fully comprehensive list, but we pulled the ones that I think are most relevant to this group. Obviously, Jarvis just talked about the updates that Claris is nearing retirement and that there will be a new system soon. The background check pieces, and then like kind of how do you navigate if there's a difference in requirements for KDHE versus the state fire marshal, and then also just like people getting, and the CAPE really launched in the midst of these regional roundtables, so I think it's like worth noting like that was like a very new thing for a lot of people. It still is, but maybe people's experiences have changed. So again, I think we've heard these things before, but I think these are the things that kind of kept bubbling up throughout the state. So we pulled together some thoughts on like what to do next with this. Historically, this group has had work groups. I know the last year we didn't really do that, but our thought is like, let's try that again. These are just some ideas. And again, like we're not trying to hold this conversation just to the regional roundtables, but we wanted to make sure that we shared this with you, and then we'll open it up to like kind of what's on your mind when it comes to childcare that you would like this group to try to really create some change with. So again, business practice support, the need for like training and just like referrals and information about supporting kids with special healthcare needs came up. I think that has been a pretty popular topic around the system, at least in spaces that I've been in. Building awareness about benefits of being licensed. I think this actually came up, if I'm recalling correctly, particularly after the passage of the bill, and just making sure people understand the difference of being licensed and why that might be beneficial if you're a provider and why that might be beneficial if you're a family seeking care. Easy to navigate information. I think this one is interesting of like, how can providers get more connected to, we know there's a lot of like community level coalitions, task force, things like that. And like, what does like meaningful engagement look like? And I think on the flip side, how do we make sure that those community level groups are effectively engaging childcare providers and that there's like a good two-way feedback stream for them? Again, looking at training needs, access challenges, and then, and this one was like a direct quote from somebody on that attended is, childcare needs are complicated. And I think sometimes there's a desire to oversimplify it and say, oh, well, if we open up more slots, then that solves the problem. But we know that that is one piece of a very complicated puzzle. And so how do we help build more awareness that like adequate workforce is a part of that too, meeting family needs, quality of care, all of that. Okay, I know I've been talking at you a lot, so I really want to stop and hear kind of like what your reflections are on this, and specifically thinking about like what do you want to do with this information? And again, we're going to also go into like, if there's something else on this list you want this group to do, we certainly want to have that conversation. But if there's something that's standing out, let's talk about it. And then I think equally important, we feel a responsibility to share something back with everyone who attended these events over the past year to just, again, say like, we've heard you, thank you. Here kind of is what the next steps for the information that you shared with, which may be that we don't quite know, but we're kind of, we really want to like, we value that people took time out of their days to come and share. And in some cases, I think be pretty vulnerable about their experiences. And so wanted to hear like what you felt like would be a good way to follow up with them. So with that, I will stop and open the floor.
Hey, Megan. So that last comment that you made really stands out to me. And it's funny how you say that because today at pickup, one of my moms, yesterday I had to close for a personal reason, medical related. And one of my moms ended up staying home. And she was telling me today how while she was in a staff meeting today with some higher up people, that her supervisor in a derogatory way mentioned, well, if such and such mom hadn't been home babysitting her child yesterday, this would have been done. So I would love, just latching onto that last statement that someone had made, just maybe some kind of like informative information that could go out to business owners, just the importance of childcare and why this is a community issue, or something to the, this is the difference between a babysitter and childcare, and you have to support your employees. Anyways, the comment made to her was very derogatory, and she came in here heated about her supervisor about the issue. So it was just kind of ironic that you had mentioned that statement that someone else had said.
Yeah, thank you for sharing that. I'm sorry to hear that. And as a working mom of a young child, like, yeah, sometimes your priorities need to be where your priorities need to be. And that is just an unnecessary stress for our family to feel that on top of everything else. So yeah, I think that's a great point of I in the kind of rest of my role, I spend a lot of time talking about like we talk about like the ripple effects of childcare, and when providers are supported and able to keep their doors open, that means that parents have the ability to go to work, which directly supports their employers, and kids get quality, in the ideal scenario, kids get quality care. And I think helping people understand that, and also that, like, again, it's just not, it's not a simple issue. It's really not. So I appreciate that. I think that's a really good way to like center, this is what actually happens to people.
Hey, Megan, my comment is very practical. I can't remember. I was at our roundtable. Did we collect like email addresses or contact information of everybody who attended? Because assuming so, whatever, I'm assuming some report will be formulated, and at the very least, we could just make sure that if they were there, they receive, some sort of follow-up communication. This is a scenario. This is a summary of what was discussed and some of the actions that will come from that. At the very least, I think that would be, important to do.
Absolutely. And yes, to answer your question, yes, we have that information. That was the original thought was like, oh, we'll do that for each of these regions. And then that just sort of, we were like, well, let's wait. Maybe we do like a cumulative summary. But yeah, I agree. I feel like that's a minimum. And I just think it's really important to say thank you for their feedback. Adrian.
I just want to jump on here and say, Mandy, jump in and help if you need to. We're very fortunate here in Wichita, Sedgwick County. Councilmember Tuttle is a huge advocate, and she is changing the language from daycare to early childhood care. And she is helping to spread the word with Councilmember Tuttle, Tanya Bullock, and then Mandy Wall from Child Start. Child Start has put on 2 different summits. One was for providers to link them to business people and talk about the importance of early childhood and care. A couple weeks ago, Child Start put on the Workforce Summit where we had, I think it was like 125 different businesses represented to talk about it. But Councilmember Tuttle's big thing is it's not a family issue. It's not a woman's issue. It's an economic issue. Because if we didn't have our early care providers, people couldn't go to work and our businesses would just suck, you know? So she is a huge advocate for us down here. And with Tanya and Mandy at Child Start as our local resource and referral agency, they're huge working together to bring businesses and providers together. And I know there's talk now about getting some trainings developed to help our family child care providers start looking at themselves as a small business and give them the tools to help them be successful on that. So yay, Wichita.
Yeah, no, there's been a lot of amazing work going on. And I mean, there's always amazing work going on in Wichita, but the last few months I think have been extra impressive. And yeah, I appreciate you sharing that. I think I mean, I have 2 thoughts. I think one, to kind of to Anel's point about New Mexico, like sometimes you just need somebody to do it effectively. And so I think being able to highlight like, hey, this is the way one community is approaching this. But I think also even giving like some language back to providers and communities. You never know who is going to dinner with somebody who might be able to influence it or whatever. So I like that idea of like kind of looking at like who has made some progress, whether it's about like language and how we like talk about childcare, or this like there's a lot I think in the system around the why it is an economic issue that I think we could kind of pull down and make sure that like anybody who wants that information at the local level could have it and kind of tailor it to their needs. That's a great idea. Jarvis.
Yeah, I just want to mention, piggyback on that. One of the things that, that I was really looking at when I did the roundtables I was at was themes across each, obviously each community is different, but still themes of how a particular community is in doing that engagement work with local businesses, because I think with the state being the size it is, I think it's going to be important. And hopefully this is a role the group can play in, but obviously it's not licensing room, but I see us as still connectors. And so if there is work going on in one community, just like Wichita, how do we get other communities that information? How are we sharing that information across the state? Maybe it is just one community that needs to get started for someone else to see it. But if they don't know, they don't know. And so being intentional about spreading that information, getting communities together, getting counties together. Obviously, with us, we work very closely with our health department. So that's something we try to do. If we see something cool going on in one area, trying to share that information with another, because sometimes all you need is just an idea to spark something. So I think that's something that the roundtables help for me to see. Obviously, you always know there's really good stuff going on, but when you hear it, and these coalitions that are doing things, it's like, hey, how do we make sure this other community over on the other side of the state knows about this? They're struggling with this. How do we make that connection? And I think the more we can do that as a state and in each community and in counties, that we're going to just continue to see progress in these areas that I think are essential to moving the landscape forward for early childhood. So
Absolutely. And I think that it's like affirming too when you know that other regions are having similar challenges. Like sometimes it doesn't make you feel better, but it's also like, okay, well, it's not just me. So I don't know, it feels like there's more of a team trying to solve for it. Kelly and then Mandy.
Hello, everyone. I read through the notes from the summary from the childcare roundtables, and they were extremely helpful. One thing I just that stuck out to me in the last slide is that you noted more support around children with special health care needs. And I would say what I read, and I don't know if it's reflective of a large group of people or if every comment was captured, but making that around supports for challenging behaviors and social, emotional, mental health type issues is one of the themes that I saw when I read through. Another one was early childhood education and curricula support. And I think it was captured in the comment around training, but sometimes I think training in my mind implies short term, one day, one evening, things like that. And I'm wondering if the questions were around sort of more extensive and in-depth trainings. I'm thinking of early literacy. I'm thinking of, behavioral supports, those sorts of things, just sort of a different lens of looking at it. And then to tag on to what Jarvis said and around sort of some of those comments as I read through it, in my head, I was like, I think that exists. I think that exists. I think that exists. So I'm wondering, again, how what is already created and going well can be communicated more effectively around the state.
Yeah, I think yes, all of that makes a lot of sense. And I think I thank you for like reading the notes in that level of detail and calling that out. I think also like we pulled some themes, so it's certainly not comprehensive. And also I don't think things necessarily have to feel like, oh, this is happening at a statewide level for that to be impactful for a group. If there is like a clear gap in something in Northwest Kansas, we can certainly have that conversation. So if you read the notes and something else catches your eye as a need, or to your point, Kelly, I think this is really common, like, oh, that's available, there's some disconnect. That's great for us to flag. So thank you, Kelly. Mandy.
Can you guys hear me?
Yeah.
Okay, holy cow. I have had the weirdest time with like trying to get myself off mute and on video, and my goodness. Adrian, first of all, thank you very much for all the wonderful words that you said about us over here. So yes, we did hold the summit and it was absolutely wonderful. We received so much feedback from people all across the state, and I'll be speaking at the recommendations panel on Friday and kind of giving like an overview of what happened and breaking down our agenda and you know everything that came from that. But it really was you know, when you spoke about like what an employer said about, you know, a person having childcare, I'm just like, do people really talk like that? Like that makes me really sad in this day and age when we're working so hard and helping everyone with childcare. So if you want a little bit more information, you know, you can tune in on Friday. But we really did have an amazing feedback and the you know the turnout of everyone that showed up, very much really great employers in Wichita and across the state. So I think that is a testimony to everything that we're trying to do within the childcare field and how we're trying to change everything. So again, Adrian, thank you very much for the nice little shout out. I appreciate it.
Thank you, Mandy. Patty.
Yeah, I think I also really appreciated going through all of the feedback and reading, really taking note of, you know, thinking about the time that went into for individuals to attend that across the state, and really looking at their responses. And I really appreciate talking about like the feedback loop of thinking about how we're going to get this back out to the field of the changes that we're you know doing and making. I have couple questions. I have one question and then just want to bring light, and I think Melissa Schoenberg can probably speak more to this as well. But I think about as we think about how we move forward and what areas of focus we can have is thinking about what work is happening with the Early Childhood Recommendations Panel, with the Workforce Development Advisory Group, and making sure that you know that we're not duplicating efforts as well. And also, I guess my question and area of clarification is that historically, I've always known the systems improvement team to be focused on specifically on childcare licensing issues related. Now that's pretty broad when you talk about everything that's impacted by childcare licensing, but I guess that's where I've really found value with the systems improvement team is when and you see really great progress is focusing on as everything relates to licensing and licensing requirements. So I think clarification around the intent of this group versus others would, you know, be helpful to know, maybe to help guide us in our focus areas.
Yeah, absolutely. I appreciate that. And I will respond to that and then hand it to you, Melissa, to talk about. I know you see opportunities with the recommendations panel because we talked about it earlier today. But yeah, I mean, I think I think it's kind of like a fine line that this group has, as I think, figured out how to walk really well. Certainly, we want to make sure that the lens of everything we're doing is through childcare licensing. Like, there's a lot of work related to childcare licensing that this group has done and can continue to do. And then I think there are like issues where it's like, oh, there's like, you know, 60% of this has to do with licensing. And then there's like 40% that is a little out of the scope. And I think we've been able to to navigate that pretty well. So I'm hesitant to say it's like we can never do anything that's beyond the scope because that's just not been the case. But I think it's kind of like our anchor that we need to make sure we're coming back to. And I think when it makes sense, like we have other groups in the system, like you just said, that we don't need to be doing the work that other people are already trying to do. And so I think part of our job is how do we facilitate those connection points to share, hey, this part of your work is like affecting this part of childcare licensing or vice versa. So I'm always hesitant to give like a blanket response to that question because it's like it kind of depends. But I think even as you saw on these themes, I think you could argue that is a childcare licensing issue, and you could argue it's not. And so I think we're gonna have to like work our way through that. But certainly we want to make sure that licensing is like front and center at all times.
Megan, I did want to mention those were some discussions we had early on prior to doing the roundtables themselves was, you know, did we want these roundtables focused on, was it just licensing, to Patty's point? And we really felt passionate, I think, about, I don't know, and like folks, like we're passionate, but when we talk to providers or parents or families or advocates, like they're so passionate about childcare in general, they want to talk about it all, you know, and we didn't want to kind of funnel them into, you know, hey, let's just keep it to kind of requirements or regulations or, anything like that. So we kind of took that approach of, hey, yes, we really, as KDHE only have quote unquote control over regulations and licensing itself, but we can definitely act as a liaison to the other agencies that do oversee that work. Or if it's a federal thing, we can pass along feedback. I mean, I kind of look at it like a no wrong entry sort of approach here is whether we're hearing about this in a regional roundtable or in another early childhood group. It's our job as like state administrators and other subject matter experts to take that feedback and know where to package it and where to take it. So that if we hear it at a roundtable and it's about subsidy, at this moment, we would take that to DCF and say, hey guys, we heard this about subsidy. We just wanted you guys to be aware and kind of let them take it from there. But those conversations have definitely occurred. It's been a tough line to toe because we want to talk about it all, right? So
with that,
I
Melissa,
would
I feel
echo
like that tees you up really well.
It does, and I would echo your sentiments, Derek, because as the chair of the recommendations panel, my goal has been to operationalize really the ECE governance structure. And what I think when you see the actual layout, things move up to the recommendations panel. And at our first meeting, I challenged the recommendations panel that not everything lives within our sector either. And we're pretty broad because of the way the structure is. Something might move down to the systems improvement team. Something might move to the state ICC. Something might go to maternal and child health council. So, and it might impact all four of those same working groups. So I think that is the beauty of the structure, is you see a lot of arrows or lines moving down. And I said we really need to reimagine that visual because they're really all intertwined like a spider web. So yes, things will sit with the systems improvement team, but something that this group might want to bubble up and recommend to the recommendations panel to take on, and vice versa. And I think that is the beauty about playing in the sandbox in Kansas, is that we all share our toys really nicely and we're all working together. And this is why I just love your soft introduction, Derek, to the Office of Early Childhood, because that is really the vision that Governor Kelly set forth. And we're just operationalizing it right now in real time. So it's not a really good answer, Patty, because I know you sit on both, but I think my gut instinct has always been, when it doesn't live with us and we need to move it forward or we need to take it back. So I just trust the professionals that's in each group to understand intricacies. And I think we do really well at it. And with that being said, I'll throw it back to you, Megan.
Yeah, no, and I think I'm really excited about the opportunities for other groups to bring things to the SIT. I think because of where Melissa's sitting in her new role and just the intentionality she's bringing to that, to bringing the governance system to life. I think we just haven't had somebody kind of sit in that role with that level of system knowledge in the past. And so I think it, again, not a great answer to your question, Patty, but I actually feel even better now about kind of us being able to push the SIT up to the line that we're okay, this is beyond childcare licensing. How do we reach out and pass the baton, so to speak, to the next group? And then how do they do the same to us when it does become a childcare licensing issue? Because obviously we want to be involved in those conversations. Okay, well, this is really helpful conversation. I want to keep it going, but also just kind of open it up in general. Certainly we can focus. I think we've got plenty to focus on with the regional groups, but also wanted to see just kind of what are you all thinking about? We will take this conversation and kind of put some potential work groups together for you all to see if that feels like the right fit. But this is kind kind of anything that you have on your mind that feels like a priority area for childcare for this group. Jarvis.
Yeah, I just want to start off by saying I talked to Megan and the team about this, but I'm excited about reconvening because I feel like over the last year or two, we've really been focused on regulations. I know been some different things that have come out, but there's all kind of things, I could say personally, since I've started in the program, that I've had ideas of what licensing can do, being innovative and doing things differently. And so I'm excited to hear about, what you all have to bring to the table just for our program in general to make us more efficient and just make us a better rounded program. So I just wanted to throw that out there. Like I said, I think that the lens has been really focused on regulations and lately, and I think this is a good time to just look at our program as a whole and make recommendations or ideas of what we can do differently or better.
Absolutely. And I think on that note, the last question on this slide is how might this group help provide information to support the Office of Early Childhood Planning process? There's a lot of question marks about that. I don't think anybody knows exactly like how to respond to that question, but I think there have been a lot of conversations in different groups of you all have a ton of knowledge and like you are on the ground doing the work every day. And so if you see an opportunity in this group or in other groups to just gather information and provide it, we don't know exactly what's going to happen over the next few months, but certainly there's just a lot of really good knowledge and insight in the system that I think if people feel comfortable like sharing through the planning process, I think there's a lot of value in that.
Megan, I don't know if this is appropriate for this group, but I'll throw it out there as a challenge that we are running into. This is more in the realm of community childcare development. There seems to be sometimes a disconnect between local fire chiefs understanding KDHE regulations and understanding even the state fire marshal regulations. And that's becoming a problem for some of our communities addressing childcare. And I don't know if that is, an appropriate focus area for this group, but I thought I would throw that out because I noticed that was mentioned in the roundtable comments.
Yeah, no, I think that's extremely appropriate. So, and this is definitely like a space if you're seeing it and hearing it on the ground, like I think it's worth a conversation with this group.
Dana, I was going to ask if you have information on that. Will you please send that to us? That would be helpful.
I would
Just
love
on some.
to.
That's a broad ask, by the way. Anybody that's running into barriers there, um, please let us know because we are working closely with the fire marshal's office. They've been great about trying to address some of these things, and the team, Jarvis and his team, have standing meetings with them. So we're always looking for kind of that firsthand experience. So we'd love examples of that. That'd be awesome. Thank you.
I would be happy to do that. I just want to point out for this group that I've gotten great response from the state fire marshal's office. It's kind of at the local regional level that we're having some pushback. So yes, I will forward that information to you.
And I just wanted to say, kind of in the same vein of that, we've actually been, and it's, like I said, one of the ideas we've had for a while, just haven't had a chance to get to it, but we've kind of been toying with the idea of having some kind of roadmap to licensure or some kind of comparison document, of getting through the licensing process, which would include, dealing with the fire marshal and kind of the differences there and what need to be done versus what needed to be done for, for KDHE. So kind of in the same vein, not exactly the same, but, I think it would be good to have some kind of easy to read document or some kind of guidelines to, help providers or whoever's trying to open, understand that route they're taking.
I don't know that this group can help, but some of the challenges we have down here, um, I have several centers. They have open classrooms, they have open spots. Their issue is staffing, and it it's coming down to the pay rate. I had actually a family member worked at a facility here for 17 years, had 3 raises, and left making $12 an hour. And we're hearing it a lot is it's the pay, and our directors, our owners, they're trying like incentives to keep them there, but a quick trip card can only go so far if you have a family. So they're seeing staff leave, and it's just because of the pay, not the job itself. So when people are like, well, I went to such and such center and they have an open classroom, but nobody to supervise it. So, I mean, that's one of the biggest things that we're seeing down here.
Yeah, absolutely. I mean, I think that's true across the board. Certainly wages are always a topic of conversation. And I think that's a really good example of the, like, it's not just a slot issue. Like they might have the license capacity, but you can't keep the classroom open without staff. Like how good is that license capacity? So yeah, I think that's always something that this impacts our work.
Megan, I'm gonna make the connection to those thoughts. We were talking a little bit earlier about kind of verbiage and things like that. I do think there's some good conversation. I've only been involved in this work for 3 years, and so those of you that have been in it for decades can chuckle at me. But I think even in my short time, I've seen a little bit of a change in the way that childcare and early care and education are being talked about. We did get invited to do a presentation at the Governor's Conference on Aging here in a few weeks around intergenerational care. And so I'm kind of partnering this thought of, like recruitment and retention efforts, obviously related to salary and pay, to, some communities struggling to attract those professionals to their communities. And I've always said that it's very similar in many ways to healthcare, and it kind of goes hand in hand because a lot of these same communities can't find health professionals either. There's nursing shortages and doctor shortages and all of that. And there was some interesting insight from K-State 105 a few years back that I heard. The top two things that young professionals specifically looked for before they would move, especially to rural Kansas towns or frontier counties, was what is the access to healthcare and what is the childcare situation like in that community. And I've seen a lot of these things go hand in hand. The recruiting and the retention of these professionals, and how can we blend those all together? So Megan, I don't know, I'd throw out a potential work group out there, if folks would be willing to see, like, how can we make licensing opportunities for currently existing businesses more exciting and more attractive. What can we do there to have our large and small employers have childcare operations, kind of under that umbrella. And intergenerational care, which is, in healthcare and long-term care settings across the state, we're seeing them use it to attract professionals for their long-term care side and kind of vice versa. And so that's really cool. They certainly don't do it as a money-making operation, but the cool thing is that exists in small towns. We see it in Alma, Kansas, and they've had a lot of success there too. So I'd just be interested for a group of people to say, because we can go around as the state forever and ever and promote these ideas, but what can we do to make that more attractive for businesses? I think it really speaks for itself, in my opinion, but I'm not a business owner, so I don't know.
Yeah. Jarvis, I saw your hand go up.
Yeah, I just want to piggyback off of that. I know for me, something that I've really been passionate about, I've only been doing this for, 3 years. I mean, many of you have been doing this for years and years and years. But one thing that was clear to me, I think, and it's the same theme, is pay. But I think a lot of these things go back to when we look at kind of like Patty talking about the licensing lens. If we're looking at that, I think we have a great opportunity now with the changes and regulations and statutes to really promote the program. I know we have the Child Care Matters campaign, but you know, I just see a lot of opportunity for licensing to go into. I mean, we're talking about businesses and not even just the business owners, but the employees that work there to say, hey, this is why health and safety of children is important. This is why licensed care is important, and to really promote the program that way. There's a lot of people I can say for myself before I started this in this position, I didn't know, I barely knew anything about anything with early childhood. So, are we promoting the program in a way that we're being proactive for employers and for their staff? Maybe they don't have kids, but maybe they're thinking about it. And when a family becomes pregnant, they know exactly where to go to get things, and they understand the importance of, yeah, they may not have kids, but their coworker does, and if their coworker can't come to work, they have to pick up that workload. And so these are the reasons why it's important to be licensed and why childcare matters. And so I just think we have a unique opportunity right now, like I said, with the landscape of things and how things have changed to really be aggressive on promoting the program and and promoting licensed care. So,
Yeah, absolutely. Is there anything else that people are seeing like, wow, this is really exciting, that's working well in my community, or not, that you think is worth looking at the state level?
I will tell you, we're having a lot of success with our regional childcare professional development conference. It's through grant support and things like that. It's a free conference. This year, we even paid for hotel rooms. So it really was a free conference. It was a 2-day conference for our providers in Northwest Kansas. And bless their hearts, if we, we can't let everybody from the state, come to that conference. I wish we could, but it's been very successful for us. And quite honestly, the bang for the buck is pretty good. You could replicate that. You would maybe have to have all the bells and whistles that we are fortunate enough to have, but you could replicate a version of that. I think fairly reasonable around the state. And for us, at least through our organization, that's a way that we are able to make it easier for childcare providers, whether they're a family childcare home or a childcare center. It makes it easier for them to stay in childcare. So for us, that's been a nice, something nice that we're doing in Northwest Kansas.
That's exciting. What's can you talk a little bit more about the like what people get for attending? Like what type of
they can attend any part of it. If they don't need, well, it used to be when we first developed it, it was that they were going to get 16 hours of training. Now, not everybody needs 16, but basically by coming to that conference, you will get 16 hours of KDHE approved training, professional development. We bring in some kind of nationally known speakers, and then we utilize Casito and Child Care Aware and some of our local resources for that. They also have the opportunity for free first aid CPR, and we make it's very much a professional conference. You check in at the registration booth. You get your goodie bag. You get your folder, your conference booklet. And the nice thing is those providers are treated and seen as professionals at that conference, and they get the chance to network, which a lot of them don't get that very often. Even those from the center level, so yeah, it's been a really powerful experience. The other thing that we offer, we have a vendors booth. We have lots of vendors. We contract with a local organization that does inspection for their fire extinguishers. At the beginning of the conference, they drop off their fire extinguishers. At the end of the conference, they pick them up and they're already serviced. And that is a service that we provide through grant funding for free. They can get their fingerprints made. So it's just kind of you get a lot for attending those 2 days. But I think probably the most important is the opportunity to network with other providers. It's great to see that back and forth between them. So yeah, it's been very successful.
That's amazing. I did not know you did that. So thank you for sharing
I've
that.
got a very detailed report and a video if you want to see it.
Well, no, I think I think that's actually, we so often talk about what's not working, but I think like there are some really cool things happening in pockets of the state, like what you just shared. It was Abby, like what's going on with Reno County, and I think they're like some of this can be like, how could other people replicate that? That sounds like a great, it's like a one-stop shop for a childcare provider. Melissa.
Well, first, I'm going to advocate for Dana dropping the YouTube link into the chat so people can see the great little video for the conference. Love it. Just actually looked at it again today. What I wanted to share, and Heather Ritchie, she can jump in anytime, is what's going on in Manhattan. They were the recipient of an accelerator grant, and they have put together an incubator site. And it's, I representing the cabinet, I got to go to their ribbon cutting, and it's just amazing. It's 8 licensed facilities, family childcare homes. They rent out the space, and they have the professional support. And Heather, it is 7:55, so I am forgetting the name of the organization. It just escaped my mind. So if you want to pipe in or put it in chat, I would appreciate it. But it's really an opportunity for a provider for a year to get all the support system to make their business and really understand those subtle nuances of their facility, and then transition to their own facility after a year. They just opened up. What was really great is the relationship they have. They also are working with their VOTEC. So their VOTEC is working on career and job opportunities, the whole workforce of Manhattan, not just the childcare workforce. And then they also have a clinic in there. So families in real time, if you have a sick child, you can go visit the clinic. So they have all of these support systems, not only for providers, but for families. It's really, truly a one-stop shop type of entity, and really looking forward to seeing all of the benchmarks and data points over this next year, and what they are able to share with the system.
Thank you for sharing that. And we got the name dropped in the chat. Okay, I know we've got 3 minutes left, so kind of start to wrap up. Are there any final thoughts? I think there's a lot in this conversation that can help us make some recommendations for work groups. And certainly if if you think of something in the middle of the night or later in the week, feel free to drop an email to me. But any last thoughts about things you'd really like to see this group work on over the next few months? Okay. Well, we will between now and our next meeting on October 21st, put some thought into like what comes next, how we can use all this information, and I think also like really try to put our feet down on how do we respond back to everybody who attended the regional roundtables. So thank you all. I know it's hard in the evening as we're all getting tired from busy days. I really appreciate your brains, and I think there's a lot of exciting things that we can do together over the next few months. So Jarvis, Derek, I didn't know if you have any final words before we say goodnight.
No, I just kind of want to echo what you said. I'm excited to get this group started back up. Like I said, I am with the changes in regulation, and in us having focused on regulation so heavily, I think it's just an exciting time for us to kind of, reimagine some things and get some different ideas going. We're always open to, change and doing things differently. I mean, you hear a lot of times someone's been somewhere a long time and they are resistant to change. And me and Derek have talked about this before. It's like we hope we don't ever get to that point where we're like, well, we've tried that, or it's like if we hear something, we want to try it. And even if it's been tried, in the past, it doesn't mean it won't work this time. And I think it's important to continue to evolve and stay ahead of the game. So, yeah, just looking forward to it and appreciate everybody being on this evening.
Yeah,
Absolutely.
I'd echo those comments, Jarvis. And what we used to say was, we want to hear all the ideas. If we've already said no to them, we will be the bad guy and say no again. But I'd rather know for sure that we at least heard the idea out. We're very much open-minded about that. And also moving forward into the Office of Early Childhood, I think we'll certainly be, talking about the importance of continuing the systems improvement team and what that looks like moving into the new office. But we've, already sent that information, started sending that information to the governor's office and to Zach, the transition director, and, assuring that they know the role that you guys have played. So with that, yes, I did change out of my tie. I'm feeding a baby and appreciate what everybody does. So couldn't do it without you guys. So thank you very much. And thank you, Megan.
Absolutely. Thank you all. Take care, and we'll see you in October.